Hello and welcome to Goa 365's Face to Face. Today is World Heart Day, and from what we've been seeing in over the past couple of years, there have been cases of heart attacks, as we commonly call them. Very young people are getting affected. Some known people are there, and even like all over India we have been seeing this. So today on this World Heart Day, I have with me Dr. Ajay Mundekar. He is a cardiologist. He has trained, he's been in the UK, he has worked in the UK. Before that he's been with Apollo Hyderabad, and now he's in Goa with Healthway. Doctor, welcome to our show.
Thank you so much, sir.
Doctor, could you, before we get into this heart, this cardiac issues or whatever you call them, heart issues, could you introduce yourself a little bit and then I want to get into why is it that we've been hearing this and younger people are getting affected by all these heart diseases.
Thank you so much for this opportunity, and in fact it's a wonderful opportunity on this World Heart Day to speak about matters related to the heart, because they are important for every one of us. So many times there are matters which are important to a particular section of people, but health and heart, these are factors which are important for absolutely everyone. So thanks so much for this opportunity. Let me introduce myself. I am Dr. Ajay Nilkant Mundekar, and I am a consultant cardiologist at Healthway Hospitals, Old Goa. I've been in Goa since last 2.5 years, and it's been a wonderful experience working at Healthway Hospitals. Prior to coming here, I was pursuing a fellowship in complex coronary interventions and structural heart diseases at University Hospital of South Manchester in Manchester, UK. I was in UK for 3 years, and before that I was a consultant at Apollo Hospitals, Hyderabad. I've done my MBBS from KEM Hospital, Mumbai, MD from Ahmedabad, and DM in cardiology from King George Medical University, Lucknow. So it has been a journey all around the country, and then to UK, and now a place which is close to my heart, which is Goa.
Why close to your heart?
I have my roots here. I have my maternal roots in Goa, and I always wanted to settle down in Goa. I have been coming here since childhood, and probably I feel there is no place like Goa in India.
That many of us agree, I think.
Definitely.
Yeah, doctor. So getting into the thing, what is this? We hear young people, 35s, 40s. Recently, there was a very famous comedian who, while exercising, why is it that we hear so many cases of people getting these, as we commonly call them, as heart attacks? I know your medical terms are different, 2 or 3, but why? What are the reasons?
In fact, probably because the awareness has gone up so much. The one good factor after COVID is everyone has become more aware of their health, and because the awareness levels have gone up, we have been hearing this, but probably this is a continuum. This thing has been gradually progressing. Previously we never used to hear about heart attacks in such young people, but maybe if you go back over a decade or 10-15 years, gradually the age group at which people had heart problems has been steadily declining. Previously we used to think that heart problems are a problem of 60-70-year-old, then gradually it came down to even 50-year-olds started having this problem, and now it has been that we see these problems not so infrequently. I would not say commonly, but not so infrequently in people who are 40 or sometimes even lesser. We have seen people as young as 23 and 25 having heart attacks.
Really? 23?
Absolutely. So there are a lot of factors which predispose to heart attack. Heart attack is probably one final thing which brings the patient to hospital, but it is, a lot has gone into it. Basically this heart attack or ischemic heart disease, it means narrowing of the blood vessels supplying the heart. The blood vessels supplying the heart are finally like a plumbing system, and if there is any choke up or blockage developing in that plumbing system, that is when sufficient blood does not reach the heart. Patients start developing symptoms like chest discomfort, getting out of breath when they walk or climb upstairs, getting tired very easily, getting palpitations, sometimes pain which radiates up to the jaw or to the shoulders, arms, or to the tummy. These can be warning symptoms prior to this final step of a heart attack. Now, what causes this? This process is called as atherosclerosis. Atherosclerosis means deposition of cholesterol and related molecules in the blood vessels. Our blood vessels are tubes carrying the blood, and these blood vessels are lined up by 3 layers. intima, media and adventitia. This cholesterol gets deposited between the intima and media, and as the cholesterol deposits, there is no place for it to go, so it will gradually encroach on the lumen, and when it encroaches on the lumen, the blood supply is impaired.
Okay.
This is something which happens gradually. The common causes behind that are excess cholesterol levels, diabetes, high blood pressure, kidney problems, stress and lifestyle related issues. These are common. Inactivity, obesity, no physical exercise, sedentary lifestyle, irregular sleep wake timings, obstructive sleep apnea, all these factors can gradually lead to development of atherosclerosis. This is one way in which blockages develop, but this is a usually very gradual way. But as against when we are talking about the heart attacks which occur at a very younger
Young age, exactly, yes.
they haven't had time to develop such major blockages. That is where it is caused by sudden rupture of cholesterol plaques. So the block is not significant. If you go back and analyze, the block could have been just 20-30%. When we talk about blocks in the angiogram, we grade them as mild, moderate, severe. Mild blocks are anything below 50%, severe blocks are usually 70% or above. So young person can have a block as less as 20 or 30%, but due to this stress and lifestyle related problems, high cholesterol levels, that block is still a dangerous block, because the cap covering the block is a very, very, very thin cap, and any stressors can suddenly cause rupture of the cap. So what happens after the rupture of the cap? These cholesterol particles which are inside get released into the bloodstream. Once these cholesterol particles are in the bloodstream, they tend to accumulate a clot, because just like if we have an injury and the blood starts flowing, the blood will try and clot it so that it is stopped there and there. The body does not recognize it, a clot forms inside the blood vessel, and this clot blocks all the blood supply. This is the usual mechanism of a heart attack in younger patients. Rarely we do see significant tight blockages as well in young people, but
What is the tight blockage?
tight blockage is the atherosclerosis that we commonly see in the elderly population. In younger population, usually it is more of clot and less of the block.
Okay, let me interrupt, sorry doctor, but now this, when you talk about clot, does it lead to strokes also? Is this the same thing?
Yes. So all this stroke or heart attack or any problems with blood supply to the legs, these are all problems of blood supply or the tubes. Depends on where it happens. So high cholesterol levels, diabetes, high blood pressure, they don't only affect the heart, they can cause a stroke as well. So when there is blockage of blood supply to the brain, it can cause a stroke. But the only difference being the stroke is of two types. A stroke can be because of blockage of the blood supply, which is called as ischemic stroke, or due to rupture of blood vessel inside the brain, which is called as a hemorrhagic stroke. But whereas in heart attack, it is due to a blockage and not due to a rupture.
Okay, yeah, doctor, now what I wanted to know is, now see, you're talking about a normal, like normal unhealthy lifestyle, you know, because of dietary habits or whatever. Normally for you to develop a block, say 70-80%, which where it is dangerous, how long did it normally take earlier, and now is it quicker, and why, if it is?
It has become a bit quicker,
Why?
no doubt about that. The reason, most important reason, is probably lifestyle, and the modern lifestyle which has brought all the amenities. Now we are surrounded by all electronic gadgets, devices, automobiles, which give us so much comfort, no doubt. We are sitting in a nice air conditioned room and lazy, exactly. That makes us lazy. That makes us lazy. So we don't walk to our workplace. We don't cycle to our workplace. Everybody of us has some vehicle, either 2 or 4 wheeler, and drives to their workplace. So the walking and exercise part is naturally withdrawn. Also, unfortunately, our climate is not so conducive to just walking. You would not want to walk to the workplace and be sweating all over.
Yes,
so that is something we cannot avoid. So what we have to do is, these are some things which we cannot avoid, but the most important thing we have to do with ourselves is discipline, discipline and discipline. Because I don't want to be like a panic monger who is like, yeah, heart attack can occur in very young people, and this can, all of us know that. All of us know what are the right things to do. The only thing is we are not so strict with ourselves and we are not so disciplined with ourselves.
I don't know if you all know, but at least I would like.
I would say that about myself as well. I would not blame them. I would
exactly?
not. I would not blame others. I would say that
No,
myself.
blame no, but what are you talking about? What should be done? Like in lifestyle, basically, if we start with lifestyle first.
Exactly. So that is where the discipline part comes in, and I was going to come to that exactly. So all of us know that we have to exercise daily for a healthy lifestyle. It's not something new that I'm telling, or it's not something
Okay, that way, okay.
But at least half an hour to 45 minutes of regular brisk aerobic exercise
Every day?
Every day would be necessary.
Okay.
Either at least five days a week should be the target. Every day should be the target. When you aim for the sky, you will reach the mountain top.
Yes, okay.
So at least we should be aiming for every day. Then at least we will manage to do it for 5 days a week. That includes brisk walking, jogging, running, swimming, tennis, any sort of exercise, basketball, football, any sort of aerobic exercise. That does not include weightliftings or push-ups. There are usually, when we talk about exercises, there are two types of exercises. One are isometric exercises, in which the length of the muscle remains the same. So isotonic exercises, in which the length remains the same, and isometric exercises. So the difference between isotonic and isometric is the isotonic exercises include all these aerobic exercises, in which the length of the muscle varies, but the tone in the muscle remains the same.
Okay.
So when you are walking, jogging, running, the length of the muscle changes, but it does not push up the blood pressure, and it is a heart healthy exercise. Whereas I'm not saying the other exercises are bad, but from a heart point of view, they do not really help too much, like lifting heavy weights or push-ups. They will help build nice muscles, but from a heart point of view, they will not be so
Only
healthy.
that probably mass, your mass decrease of mass, that it will stop as you grow old.
Absolutely,
That's what
absolutely,
you're-
absolutely,
okay.
absolutely. So at least 30 minutes to 45 minutes of brisk walk, avoiding fried stuff, avoiding very oily stuff, reducing the amount of oil and saturated fat intake in diet, reducing the amount of salt in diet, increasing vegetables, salads, pulses in our diet, and having a regular lifestyle. What I always stress upon, I say to all my patients, is there are 3 pillars. When I'm treating you, there are 3 pillars. One is diet, second is exercise, and third is medicine. Medicine comes the last, but each one is equally important. So if I just give you medicine, that does not mean I'm curing you. If you continue your diet, exercise and lifestyle as it was earlier, just the medicines are not going to do everything. You will again land up with problem. So if we want to have a really healthy lifestyle, we have to be disciplined with ourselves from a quite younger age. The reason why we have seen that this problem starts much earlier, and pathological studies and scientific studies have shown that as soon as the infant is born, it's a very early process. There can be what we call as fatty streaks in our arteries, which can be absolutely normal, but these fatty streaks growing into atheromas, that is balls of cholesterol which go on to block that artery, that is a lifelong process.
Okay,
It's not
keeps on
something
adding, keeps on adding.
Yes, it's not something that starts at 50 years of age, so that sometimes people feel like I'm still young, I'm 30, I can just continue doing whatever I want, I can drink as much, I can smoke, nothing is going to happen, I have to follow a healthy lifestyle when I reach a particular age. That is absolutely wrong. It is a continuum, and a healthy lifestyle has to be inculcated at a very young age, probably from school days itself.
But there's very boring life, no? Don't you think, doctor? But no choice.
Everything in moderation is perfectly fine. Moderation is the word.
Okay.
There are some things which have to be absolutely avoided, like tobacco and smoking. Even a little bit of smoking and little bit of tobacco can be extremely dangerous.
Okay.
But when we talk about alcohol, as long as it is done in moderation and socially, that's absolutely fine. But binge drinking is dangerous for the heart as well.
So at what age should you stop all these things, whether in moderation also?
There is no particular age. Like just now we have a very good example of Queen Elizabeth, and everybody must have heard of the drinks that she used to have.
Yeah.
So even at 90 she continued to have her drink,
Yeah, normal. Yeah.
which is absolutely fine. And as long as you are keeping healthy, you are doing everything, is perfectly fine. And that is also one difference between the European or white population and the South Asian population. Genetically, we are predisposed to diabetes, high cholesterol levels, and early development of atherosclerosis.
Why is that? Just genetics?
It is. We have.
Is it of the climate or what? Could be any reason?
It is basically climate has a lot of role. But climate has a lot of role, but that has been over centuries and centuries. These genetic things that we have been over centuries. Probably why we are noticing it so much is we always like to think of the old as very good. We only remember the good part from the old.
Yes, yes.
But what we don't realize is life expectancy, if you go back a few decades, was much lower.
It's around 30s.
Yeah,
40s.
30s, 40s was the life expectancy. If somebody went on to live till 60 and 65, it was like he lived a very long life. Today, if somebody dies at 65, we feel that
Very young.
he died at a very young age. So people do continue to live for a long life, and that's why the prevalence of these problems has been much more.
And also probably the diagnosis, medical diagnosis, all the
Absolutely.
technology, all that has also gone up.
Absolutely. The diagnostic technology has gone up, and thankfully the Indian healthcare sector is in a very good shape. I've worked on both sides of the fence. The emergency services that were provided by NHS UK were phenomenal. Like you have a cardiac arrest or heart attack in the middle of a jungle when you are trekking up a mountain, and they will send a helicopter to pick you up and save your life. At the same time, on the other hand, the outpatient services, sometimes people end up waiting for 6 months just to get an outpatient appointment there.
Okay.
As against in Indian healthcare sector, the availability of specialty and super specialty services is so good that patient has to make a phone call and reach the hospital, and he can immediately avail the services of a specialist or super specialist.
Especially private healthcare in India has really
It has picked
up a lot. You have and even even the government, like in Goa,
Absolutely.
it's good.
The
But in many places it's not that good.
Very true,
Right.
very true, and that is where Goa Medical College is doing a phenomenally good job. Major factor to it is probably we are able to provide these services because of a relatively limited population. Like for example, if you are catering to a population of
Massive,
1 crore, then it
it's
becomes
tough,
a very challenging
very tough,
job.
yes.
The GMC is doing an amazing job providing services to masses of people. The Goa government has a very good DDSSY scheme. This there is no scheme like DDSSY in any of the other states. The DDSSY gives a free hand to operate and to give the best possible care to each patient. What happens in other states is you need to have a white ration card, you have to be below a particular limit, and then you will, I've personally seen people getting out of swank cars, posh cars, and bringing up a white ration card. So that defeats the purpose of the system. As against here, this scheme is eligible for all Goan citizens, which is a very
Also
very
today
good.
lot of people are going into private insurance also is there.
Yes,
Means
absolutely,
companies are taking care, or even
Absolutely.
private, and people are preferring to keep. So that at least keeps some
The
sort of,
awareness about health insurance is another step.
Yes.
What happens is medical science has grown by leaps and bounds. There are lots of technologies which are available, which are really good for the patients in short as well as long term. But these technologies come at a price,
Obviously.
and nobody can provide all these technologies for free.
That's
So that's where the healthcare costs go up. Like for example, there are advances in cardiac field like transcatheter aortic valve replacement, in which we don't even have to cut open the chest. We just have to put a tube through the groin, crush the previous narrowed valve, and put a completely new valve, which nobody could have imagined a few years ago.
absolutely.
But there are costs involved. Previously, only some foreign companies were making these valves, and the cost of these procedures used to be 25 to 30 lakhs. Now, Indian companies some Marine Life Sciences and some companies have come with Indian valves, and the cost of these procedures have gone as low as between 12 to 14 lakhs.
which is very
And
less.
there are going to be further advances as the technology evolves. The cost of the technology goes down. But even so, bearing 12 to 14 lakhs from
It's
own
a lot.
pocket is very difficult for a majority of people. That is where healthcare, health insurance, or schemes like DDSSY have a lot of role.
Okay, doctor, now I would like to get into some. There's been a lot of discussion about COVID hit us very badly past 2-3 years.
Absolutely,
And the
absolutely.
vaccination, and there have been people are saying that because of that there were clots and there were more heart attacks. What is the fact and myth of this? Is there some this to it, or what is it exactly?
The thing about COVID is we are still learning more and more about COVID. What we know for sure is COVID is not simply a disease related to the lungs. Initially, it was thought it was just like a flu. What is COVID going to do to me? Then it was realized that COVID causes massive pneumonia and destroys the lungs. Then it came to notice that it affects so many systems. So what it does is it creates a state of significant or severe inflammation inside the body, it can affect the heart in multiple ways. It can lead to clot formation in the veins, in leg veins. This clot can migrate to the lungs, causing pulmonary embolism. These clot can form in the blood vessels supplying the heart, leading to heart attacks. There can be decrease in the pumping of the heart, leading because of things called as myocarditis and cardiomyopathy. There can be fluid accumulation around the heart, pericarditis and pericardial effusion. COVID can affect heart in multiple ways. So the way it affects is by causing intense inflammation all over the body. What you must have seen is commonly in any patients with COVID, normally D-dimer and CRP tests are done.
Yes.
So these D-dimer and CRP generally reflect the level of inflammation inside the body. The higher these value, the higher the chances of getting COVID related problems. And the problems don't end immediately as soon as you're done with COVID. There is a long post-COVID syndrome for some, and complications tend to arise later as well.
Okay, now assume now, okay, all these things, problems we have understood all. Now what are the solutions? What do you do? Say for example, if you are like say 50 and you have prone to not yet diagnosed, maybe you are going to, maybe you've got diabetes, maybe you've got high blood pressure, maybe you got X, maybe you have stress. What do you do? How do you sort it out? You can't just give up your job.
You can't.
Then what do you do?
You have to make time for yourself.
Like what?
Making half an hour for oneself is not difficult. And what happens is, yes, what happens is, once I have noticed it myself, so I can say, once you're not exercising, then every step seems so much of an effort.
Yes.
But once you get into the rhythm and you start exercising daily, the initial part is tough. You have to bear through that pain initially, but once that becomes a habit, you continue doing it for 15 days, 1 month, 2 months, then when the day you don't do it, you feel something is abnormal. And then you get into that lifestyle. Automatically the time you sleep gets regulated, because you will need that much amount of sleep.
Yes.
You will try not to keep
to sleep? 6 to 8 hours?
Yes, absolutely. If possible, up to 8 hours would be always better, but so many times it is not possible. 6 to 8 hours.
See, people like us, like you or me, for us 8 hours is a luxury, unless it's a, I mean, like you are, so then what?
Absolutely.
But yeah, basically high stress jobs are prone to all this.
They are prone to it. They are prone to it.
And
We cannot help it. And there are so many times, like in your job as well as mine and so many other jobs, we won't get a full night's sleep. Suddenly in the middle of the night you'll keep on getting calls, or you'll have to reach the hospital or reach the workplace, and that is something we cannot avoid, but we should control what we can.
Diet,
yes.
we've been hearing like you must have you said saturated fats and all that. Then you also sugar is not too good. Salt,
too much of sugar is not good.
Too good. Then maybe carbo is not too good, or what like wheat is not good. Now
The
people
thing,
gluten.
thing with our diet is usually very rich in carbohydrates. We like our breads, roti, chapati, naan. We have so many types of bread. Kulcha. Just you go to a restaurant menu, you will have 15 types of rotis, rumali roti and whatnot. So we love our breads, which are again very rich in carbohydrates. White breads, white rice, they are very rich in carbohydrates. Try and avoid. What we should try and do is try and limit the amount of carbohydrates. So for example, if I am eating 3 chapatis today, I'll try to tone it down to 2 or probably 1.5, and try. I'm not saying that we should remain hungry, but what we should do is increase the amount of proteins, vegetables. These are the things which are
vegetable proteins are better, like pulses and all, or white meats, fish.
White meats are also absolutely good.
Red meats avoid.
Red meats, the reason for avoiding red meats are they are usually rich in cholesterol, and from heart point they are not
too good. Even especially processed foods and all.
Processed foods are definitely not good, because processed foods, besides having a concentrated rich cholesterol, they're also rich in salt and preservatives, which are not good for heart. Any sort of processed foods are always not good.
But what if now all the time, if you're going to stick to the diet,
definitely not. Once in a while you can always. Definitely.
But basically what you're saying is diet, exercise. How are you going to avoid stress?
Stress is something everyone has to manage.
Do yoga.
Exactly. For some people, doing yoga may not help as well. So yoga, meditation, these are definitely these are ways in which one can avoid stress. A regular lifestyle or regular sleep time, that goes a long way in reducing stress levels.
Now when you mean regular, means suppose you sleep every day at 3 o'clock, so you should sleep every day at 3 o'clock, or try and sleep at 10, which is not possible. Say for example for you or for me, again I'll bring that. Then what?
If you are used to sleeping at 3 o'clock,
then
your body develops,
used
there
to
is a
it.
sleep-wake cycle.
Okay.
Then it's good to maintain that sleep-wake cycle regularly,
Okay.
so that you sleep
So
at
don't
3,
change
wake up
that.
at 9, 10.
Yeah.
That is fine as well.
Okay, fair
Yeah.
enough. Doctor, it's been a pleasure talking to you. We have reached our this, but it's something that our audience should be aware of. We need to exercise. We need more moderation and balance in our food. We need to chill, not get so stressed out, because anyway life will go on whether you get stressed out or no.
Yes.
That's what I
So like I
always say.
said, one message towards the audience is, I don't want to be a panic monger.
Okay.
All of us know what are the right things. I'm not telling something new or something that nobody has heard.
We're not inventing the wheel.
I'm not reinventing the wheel.
Yeah.
So a discipline with ourselves is the only message that I would like to give on this day.
Okay.
Because all of us know what has to be done. It's just that we don't put it into practice. Today is the day when we should decide that we are going to be strict with ourselves, we are going to be disciplined, and of course nobody is saying for having a good time once in a while.
Oh, yeah.
As long as we don't do it too frequently, everything is fine. Everything in moderation is fine.
Absolutely. Yeah, thank you, Doctor, for coming on a show. It's been a pleasure hosting you, and hopefully we will see you again. Thanks.
Thank you very much, sir. It was a real pleasure, and thank you for the opportunity.
So as you said, discipline, as Dr. Ajay said, that discipline is important, but I'm saying not only discipline in food and food habits, in anything you want to succeed, you need discipline. You want to be successful in your job. I'm sure doctor has put in lots of efforts and study to reach where he has. You need to be disciplined generally in life. I think that's one of the things. Okay, you need to let your hair down once in a way also, but discipline, consistency, all those things, I think, which our old people used to say, I think that holds good for everything in our lives. I think for a successful, happy, prosperous life. Thank you again, doctor.
Thank you so much, sir. Thank you.
And stay safe and keep watching Goa 365.